As we turn to the coronavirus story more broadly, Ontario is struggling to keep up with the demand for COVID testing. The province is trying to clear an enormous backlog at its labs. There are tens of thousands of swabs waiting to be processed, and Laura McQuillan is here to tell us that Ontario is having to take drastic measures to try to clear that backlog.
That's right. We're learning that many of those swabs now being sent down to California for the testing to be done there. These are specifically for pharmacy tests, and you have been able to get a pharmacy test since the 25th of September under specific circumstances. It is quite restricted, but what we're learning is that Ontario pharmacies carry out those tests, then send those swabs to North York, north of Toronto. They're sent down to California. The results go back to North York, then to the pharmacy, then they're put into the provincial database. So we don't know if it costs more or less, if it's any faster or slower. I have reached out to the province to find out details about that this morning, Heather. Still waiting to hear back. I also asked them, are other tests being sent outside of the province to get those results? Because we know there has been that enormous logjam in those labs here in Ontario. That's why those assessment centres were shut the past 2 days, trying to clear that backlog and reopening today by appointment only. What we have heard from Premier Doug Ford just in the past day is there are real issues getting enough diagnostic lab technicians and also enough chemicals to process the tests here in Ontario. So it would be interesting to know whether more of them were being sent outside of the province to get them done. Something that was interesting to me when you spoke to Dr. Isaac Bogosh just a short time ago, him pointing out we knew that the spike in cases in fall would be coming, and he was questioning why the province wasn't better prepared in the way of labs and testing. Take a listen to what he told us.
We knew months ago that it was going to be a challenge as we entered the fall and the winter. We knew there was going to be an expected rise in cases. It's clear that we could have done more to prepare for this. Having said that, I think given the resources that we have available today, they're using those resources effectively. The key thing here is how can we rapidly scale up those resources, because there's still a long fall and winter that lies ahead.
And in terms of finding some other resources, we heard from the Prime Minister yesterday that federal labs will be joining that effort, helping out Ontario with about 1,000 test results a day. When you're looking at a backlog of about 70,000 up until yesterday, that is just quite a small number, but the Prime Minister saying they will add to that capacity, because it's not just Ontario, it is across the country that labs are struggling to keep up, Heather.
Something else, Laura, that we're watching today is Health Canada's investigating reports. In fact, we've been talking about this on this program for a number of weeks now, that there are private clinics, a number of them in different provinces, giving tests to Canadians who can pay to avoid having to wait in those long lineups at assessment centres.
Yeah, and you mentioned us talking about it for weeks, yet when the Health Minister, the Federal Health Minister, was asked about it yesterday, she seemed quite caught off guard. She had just yesterday spoken with the Prime Minister about it, and he had said he would be speaking with her, so she confirmed they had spoken. But these private clinics offering tests, if you can afford them, somewhere between $50 and $250 with a turnaround time of about 1 or 2 days, which is a lot faster than you're getting at many of the labs across the country, those public labs. But Paddy Haidu, the Federal Health Minister, was not really thrilled to be asked questions about these private testing facilities yesterday. She said there will be follow-up done on that. Here's more of what she had to say.
I've spoken with the Prime Minister, and I have my department looking into the nature of those clinics. But generally, no, we prefer that there isn't a two-tier public health system. In fact, the law says explicitly that that should not exist, and we have a number of measures that we can take under the Canada Health Act if that's happening.
So it will be interesting to see what might take place in terms of that action. I reached out to a number of those providers across the country this morning to hear their take on things, the work they're doing. Haven't heard back from any of them yet. But one other key aspect of what the federal government was saying yesterday is something that we were speaking about yesterday morning, Heather, contact tracing, because that is becoming a huge issue, especially in Ontario. We have seen Toronto Public Health say that it really needs to scale down its contact tracing. Ottawa saying it's at crisis point. And in fact, Montreal about a week ago said it was going to have to tell people to contact their own contacts because it simply couldn't keep up. So yesterday, the Prime Minister speaking on that point as well, saying that there would be more federal help on the way for Ontario, Quebec and Alberta, about 500 contact tracers specifically for Ontario. Interestingly enough, Toronto's top doctor yesterday saying she already has 700 contact tracers even 700 more for the City of Toronto would not be enough, calling for more restrictions, as many local leaders are across the country right now. And on that point, we'll be watching to see whether there are any announcements of new restrictions when Ontario's Premier speaks around 1 p.m. today, Heather.
Yes, we'll have that live. Just announced 1 p.m. The head of health, CEO of Ontario Health, his Minister of Health as well, the Officer of Health for the province at 1 o'clock joining the Premier at that time.